Shall we wait for 2 or 3 minutes or shall we start now?
I think we should start.
Start.
Okay, sir.
Just
I
request
must
everyone to be
yeah.
on mute and video off.
Yes, sir. Okay, so good evening, everyone. This is Swati Sambyal on behalf of the Batu Alumni Association. Welcomes you all in this most awaited webinar on mental health awareness by Professor Prashant Valluri. As we see that living in India, this issue is not very common. I don't know why it seems taboo to talk about all these things. Our society from the very starting has told us how to get good grades in academics. They have told us how to get along with our life. They have told us how to be morally correct, but they have never told us how to fight depression. They have never told us what to do when you're feeling anxious about something. People have this perception that if you can't see the depression, it's not there, which makes people like us so wistful and aggrieved. And that's why our team decided that this issue should be talked on. Not for us, but I think for the people out there who are fighting this battle for the very long. So, without wasting much of your time, I would like to call Mr. Santosh Ingole, sir, for the brief introduction of this webinar. He is General Secretary of T. Batu Alumni Association. He he's Chemical Engineering 1998 pass out. He joined DGA QA Ministry of Defense through UPSC, completed M.Tech in Explosives, and presently pursuing PhD in Metallurgy from Pune University. He is designated as Joint Director in Ministry of Defense handling portfolio of air engines as well as fuel oil lubricants for military aviations in DGAQA. So I'll pass on my mic to Sir now. Sir.
Yeah, thank you, Swati, and thank you, one and all. Indeed, a pleasure to join us back on this webinar series. This, in fact, the topic is very interesting for today. That is mental health awareness. Before going for the actual webinar, I take this opportunity to tell something regarding the activities of Debatu Alumni Association very quickly. We started, the Debatu has started 31 years, 32 years back, and many of our producers, they have attempted to form the formal alumni association of all the departments. And a few of our friends, we joined together, we made the foundation, and we are going ahead for registration of the official alumni association. See, the basic approach of our alumni association is to have the synchronous approach, the keeping students at the center stage and supporting the ecosystem actually. And so in the ecosystem, all the stakeholders are involved, the students, the faculties, the upper management, all the alumni. We have last 32 years, almost more than 25 batches has been passed out. Earlier, it has started with only petrochemical branch, then two more branches added, then three more branches added. Now, in total 8 branches are there. So, summing total of only undergraduates, alumni, the strength is more than 15,000, and to get all together on a single platform, that is our main agenda, and taking everybody together, how we can pass on the how we can pass the utility of this networking to the students, and how we can see our Batu is growing further. We need to foster the relations, and we need to build the team. It is not only for the students. We need to have the webinars or the sessions, but as well these alumni, those who are recently passing, those who are in the middle level of their management or the career, to them also this alumni networking can be a better platform. And shortly after our registration getting over at Alibag office, we'll be launching our website, full-fledged website, which is developed by a commercial, which is with commercial software, and we await that to happen as at the earliest possible. Okay. This is the simple introduction for the Alumni Association. We have a lot of activities going on in the background. Not taking everybody's time. Today's speaker, I know him very personally because he is my own classmate, Prashant, Prashant Valluri. He used to stay in Sevas, and we were taking all his guidance during his time. We enjoyed our all 4 years, and today we are lucky enough that we have the speaker with us of the caliber what is there. So I pass on next to Swati to formally introduce our today's speaker and the next. Thank you.
Thank you, sir. Moving next, I would like to tell brief about the today's speaker, Dr. Prashant Valluri. He is all chemical 1998 pass out, completed his PhD in chemical engineering at Imperial College London. He is currently a personal chair in fluid dynamics, head of graduate school, professor at the University of Edinburgh, UK, JSPS Invitational Fellow at Kyushu University, Japan, and honorary advisor at BIT, Pune, India. So I would like to pass my mic to the sir now. So,
Thank you, everyone. So thank you for inviting me for the talk. I hope you're able to hear me. Swati,
yes,
you're
sir.
able to hear and see me? Yeah, good.
Yes.
That's good. That's a basic check. So just to give you a brief thing before I share my slides and everything, is Swati, you did a really good introduction before where you talked about mental health and why it's not spoken much. It's not just true in India; it's everywhere. Okay, it's just true everywhere. People don't want to speak. People didn't want to speak about it. It's only now that people are trying to speak about it. Okay, and so basically, the more we speak about these things, the more we know the cause for mental health. I mean, there are a lot of reasons. I mean, I'm not an expert in this. I'm not a psychiatrist. I'm not a psychologist. But what I can do is I'm going to bring forward my experience as the head of graduate school. I have looked into. I mean, I take care of about 500 PhD students within our school, and obviously there are many such people who will present with very complex situations. I have also dealt with complex corporate situations where mental health played a big role. So I'm just going to share some of my experiences. Okay. So the way my talk is going to be is I did give this talk, a part of this talk previously in one of the D-Batu seminars. So I'm going to be talking about the causes for mental health to understand what is the reason for some of the main reasons for which mental health issues turn up. Okay, and they can turn up with anyone. Okay, I think the statistics are 1 in 3 of us will pose some sort of a mental health issue. Okay, so it's going to be a very, very common problem. It is a common problem, but I think as stresses go and as things grow up, we'll see more and more of them. Okay, so but ultimately, what I'm going to also talk about is what can we do, what can students do, as students, as academics, as professionals, what can we do to alleviate some level of these stresses? Okay, so with this, I'm going to just present my slides. I'm going to share my screen at the moment. Okay, screen 1, share. Swati, you need to let me know if you can see the screen.
Well, I can't see the screen. Yeah, I can see.
Okay, so basically, okay. So what I'm going to talk about. Yes. Can you see the screen?
Yes, sir.
Yeah. So what I'm going to talk about is mental well-being, but what I'm going to talk about is also about how to make sure that we are resilient, but at the same time, what can be done? I mean, there's a larger social factors which can be done to improve mental well-being, whether it's a university, whether it's a workplace, or whether it's your home as well. Okay, so let's just get on. So first of all, as I mentioned, I'm not an expert in any of these topics. I am just putting forward my experiences. I graduated, as Santosh mentioned, I graduated in 1998 from chemical engineering. Then I worked for some years in India, and then I came for my PhD. I was working at London for some time, and then I came to University of Edinburgh, and I grew up the ranks, fortunately, and basically, and during my time, I have dealt with several things in terms of research, in terms of teaching, in terms of governance, in terms of industry collaborations, and also grant panels and things like that. Okay, and I'm also have got several honorary appointments around as well. Okay, so I'm nothing to have. So you can see that I'm not a psychiatrist. I'm not a mental health expert. I'm just sharing my experiences. The more experiences we share, my strong belief is the more experiences we share, the more we learn from each other, and the more we'll find solutions if we work together. Okay, so basically, what is it? So we may be the sum of all of our experiences and our environment, but importantly, what is our mental health? Mental health is the product of everything. Okay, so I come from the mathematical end of fluid dynamics, so I can say mathematically, mental health is our product of our entire state, and it sets boundary conditions in our life. Okay, so if you consider any sort of a challenge, you know what your boundaries are. Okay, you know what your boundaries are. Sometimes you can push those boundaries. Okay, sometimes you can push those boundaries, and sometimes you know that you cannot push those boundaries. Okay, so it's like, yeah, I can cycle well, but I know that I'm a terrible swimmer. You can train me as much as you want. I know that I'm going to fail in swimming because I really cannot do swimming. Okay, so I know my boundary conditions. Okay, and it's important to recognize what your own boundary conditions are. Okay, and that will help make sure that, okay, you don't need to be perfect in everything. You don't need to be at all perfect in anything. All you want to do is basically acknowledge what you can and what you cannot do. Okay, now there are several issues which begin. I mean, the thing is, as I mentioned, there are several social issues that come together which contribute towards mental health. Okay, whether it's a student, whether it's an employee, the beginning of mental health challenges lie in bias. Okay, so basically, what is bias? Bias is basically, say, I mean, you walk around wherever you are, you will see a person and you make a judgment. Okay, you make a judgment. I can see that person. He seems to be cleaning dustbins, so he must not be really great in doing something. Okay, so there are these biases which we as humans are unfortunately wired with within our brain. So there are biases which are there. It's some sort of a rule of thumb. It's a shortcut. Okay, which says that, oh, if I mean, in India, in every society has got several types of biases. I mean, I can tell you, from example, in India, for example, one of my own sisters, when she did not wear a bindi, people started saying all kinds of things to her. Oh, she's careless, she's this, she's that. And this is ridiculous. No, right? I mean, it's nothing like that. Okay? I mean, just because this person is not wearing a bindi doesn't mean that she's terrible a person. No. Okay? Just because she's able to speak her mind out doesn't mean that she's rude. Okay, so there are all these biases. So these biases are basically human nature, but ultimately it's important that we recognize what these biases are, what type of biases come into picture. Okay, so these are some cognitive biases that happen in our workplace. So one is confirmation bias. That, I mean, in the COVID crisis, we have seen all kinds of examples. Okay, so it's going to be. There is going to be, COVID is simply like a flu. No, it's not a flu. Because someone has confirmed it, I will just imagine that it's going to be like a flu, and therefore I'm going to believe in that. So there is a confirmation bias right in place. So people will say, COVID is like a flu. You don't have to worry too much about it. Okay, that is completely wrong. We know that COVID is a serious disease. It's not at all a flu. It's a very dangerous disease. It can kill people. Okay. Kill people with remarkable accuracy. Okay, so that is that confirmation bias. The other thing is primacy. Okay, a primacy bias is something that you would say, oh, this has happened before, so this is going to be happening the same time again now. It's going to be the same way. Exactly happened in COVID. So people would say, oh, during summer, flu is usually less in number. So I'm sure COVID as well, as temperatures rise, COVID also will go down. COVID completely tore apart that assumption. You can see what is happening in India now. We had an astounding rise in COVID cases in Britain as well. Okay, with 150,000 deaths. Okay, so it's again that primacy. Then there is something downright bizarre, like it's weird, bizarre, nonsensical stuff which people tend to believe. Okay, one of the things I found it really bizarre, but I was really a bit ashamed as well, is when I got a PhD application from India. Thankfully, it was just one in so many thousands I see. That this person wanted to work about Vedic gravitational waves. What is this? What is that? No, there's no such thing. I mean, it's downright bizarre. And the thing is, the person was very convinced that this is something which he can work on. I mean, obviously, confabulation. Confabulation is where, this is the blue thing there. Confabulation is where you find stories and patterns which don't exist. Okay, in very sparse data. So, for example, when COVID started, people had little amount of data, and then they started making statements like, "Oh, this will work with chloroquine." No, it doesn't work with chloroquine. It has nothing to do with chloroquine. It has nothing to do with malaria. Okay, now, and then Occam's razor. Occam's razor is, if you are confronted with a difficult issue, extremely difficult, complex issue, people will say, if it's a complex issue, it has a simple solution. Okay, if you find out a simple solution, that is the solution. So what happens is you're presented with a very, very complex problem, but what you will do is you'll just nitpick in small things. Okay, and that's what happens when it comes to racial bias. That's what happened when it comes to diversity and all those things. Okay, so that's an Occam's razor. People would say, "Oh, we can just put a diversity rep." No, that doesn't work. The other thing is sunk cost and system justification. These are pretty similar to each other. So to avoid mistakes, we avoid irreversible decisions. So basically, we don't want to take difficult decisions in our picture. Okay, and of course, all the most important cognitive bias that we have is overconfidence. Oh, we have done this before. It's going to happen in the same way. No, it doesn't. Okay. So basically, why do you have these biases in society? I mean, these are basically humans have got this amazing capability of having motivations. They have got heuristics. They can assume things that can happen. Obviously, the most important thing is social pressure. Okay, and it's not just social pressure. I'm going to come what exactly affects students as well. Okay, I'm going to come to that. And then, of course, different kinds of emotions. Oh, what will other people think about me? Okay, am I performing as better as what society expects me to be? Okay, of course, this is again a different kinds of things. The most important thing we have seen during COVID is the Dunning-Krueger effect. So people with little amount of knowledge on COVID will give you WhatsApp messages saying that, oh, this is what the solution is. Drink 5 gallons of lemon juice and you'll be fine. Or boil something to death and you will be fine. No. Okay. So the less you know, the more confident you are. That is the Dunning-Krueger effect. Okay. You also have framing error. I mean, you will present with a completely different conclusion based on an idea that is presented to you. Okay. You can have all these things which affect your biases. You also have authority bias. Okay. So some people would say, oh, I believe this political leader, or I believe this person in my group. So I listen to whatever he says. Okay. I listen to whatever he says, whether it's downright incorrect, whether it is inappropriate, or whether it is whatever it is, I'm just going to believe in what it is. Okay. We have had several of these gurus in India. Okay. We keep having them unnecessarily, and people tend to believe them because they have such an authority. They have such a kind of a crowd pull. that they can really influence a lot of people. So there is this authority bias there. Okay, and of course there is false consensus. There's obviously people would say, oh yeah, I mean, there would be this thing about saying, for example, it's very much common in the West that, vaccines should not be taken for some reason, some weird reason or the other. There is a false consensus, and people just go along with it. Okay, so there are several things that come into picture, especially with biases. And what happens when someone is taking this bias? They are affected by society, and they would say, oh, the society says this, but I don't believe that. If I have to fit within the society, I need to make myself work hard or make myself do something else. Okay, so of course there are several types of social biases as well. I mean, in Indian, obviously you would have gender bias. That is very, very common. Okay, race bias, we have seen that all over the world. We see that all over the world. Color of the skin. I mean, even in India, you have this fair and lovely business and crap. Yeah, the rush to have this fairness, fair skin, and it's nonsense. Okay, then body. Oh, he looks very large, so he possibly is completely unhealthy. Do you say the same about sumo wrestlers? They're terribly healthy, actually. They're really, really good. Okay. Of course, there are some cases where you can identify a person saying, oh, probably his mental health is not well. Okay. You would have these things, and you would also have visible disability, people who are blind, people who don't have limbs, people who don't have a certain aspect of their senses. Okay. And of course, there are other invisible cues in society. Caste, again, race. Okay, people may sometimes. I know of several of my friends who have been assumed to be of a different race than they are. Okay, and put in all kinds of innuendos and things like that. Okay, so caste, race, faith, religious bias is prominent everywhere. In any society I have gone, there is religious bias. Okay, there would be, I mean, if you go to Ireland, for example, you would have issues with Protestants and Catholics. It's madness. It's just, they just want to kill each other. Okay, in India, we know that there is a huge issue with religions. Okay, sexuality and language. It's very, very common. Oh, this person seems to be gay, or this person seems to be this. So I cannot really, and we should really target them for bullying or whatever it is. Okay, language. Okay, people of the same language will flock together. So obviously the others, or if there is another person who doesn't speak the language, they are completely left out. There are, of course, invisible disabilities like spectrum disorders, like autism, dyslexia, and things like that. Okay, you also have these value systems, like, for example, what I said about my sister. They say, oh, she didn't wear a bindi. That means that something is terribly wrong with her. No, she's fantastic. She's now a really, really accomplished person. Okay. Okay. Perceived family background. Oh, this person comes from this background. This person comes from a certain, his parents are this. So therefore, I'm sure he would not be having great educational background or something like that. So you've got all of this, and you've got school of thought. So you've got all these things coming together to form a bias. Okay. And ultimately, when a bias ingrains itself within the society, ingrains itself within a university or anywhere, then that's where you have issues of equality and equity. Okay. Now, what is equality? I mean, the thing is, I know that I'm going a bit more broader than mental health, but what I'm trying to tell you is all of these things come together to influence mental health. Okay. So what is equality? Now, equality is to ensure that every person, no matter what they are, no matter how they are, no matter which color they are, no matter which orientation they are, whatever it is, they have an equal opportunity to make most of their lives. They have equal opportunity, okay? Ensuring that everyone has the same treatment and receives the same treatment, okay? That is equality. What is equity? Equity is about giving everyone a fair chance, okay? When you say giving everyone a fair chance, you will obviously have different levels of the society. Some people are well off financially, some people are less well off. So basically, when you say you have to give more to the people you have to give more to the people who are less well off. This is what is equity, to make sure that they come to the same level as those who are well off. Okay, so basically, for example, if you're providing more support to a disadvantaged student, okay, by giving them more support, by giving them more tuition support and things like that, that means that they are coming at the same level, to help them come at the same level as a normal student, okay, as a normal common student, okay. Now, what happens? How do you describe this? So basically, look at this. So you got these three persons who are watching a football match, okay. You've got these three people, each one of their different heights, okay. They're standing on the stool. So equality means everyone gets the same stool, okay. Everyone gets the same stool. Obviously, this guy who's short, he can't even see anything. Now, what does equity do? Equity says, come on, this guy is tall, so he should not be getting. He can always see the things irrespective of whether he has a stool or not. This person may benefit from a stool, let her have it. But this person, take the stool from this guy and give it to the shorter guy so that he can see it. Okay, that's what is equity. So you're making sure that everyone is able to see the football match. Okay, is able to see the football match. Now, what is justice? Justice is when you remove these barriers completely. You remove these barriers completely so that everyone is included in the football match. So you, rather than having a kind of a wooden fence, you're putting basically a transparent or a kind of a caged fence. Okay, so that no matter what your height is, no matter what type of person you are, you're still able to see the football match. Okay, so the idea is, if you want to make sure that equality is the end goal, equity is the means to get there. Okay, so that's why when we say we have scholarships, scholarships are given they're of different kinds. You've got scholarships for disadvantaged people. They are of a higher value, obviously, because to make sure that they are up to the same level. And you've got scholarships for normal people, for other people as well, which are of a lower value. Okay, so essentially to get them to where they want to be. Okay, now what are the risks to any workplace? What are the risks to any workplace? So one of the things is definitely career stresses. So each one is worried about their own career. Okay, so this is what is causing this is the origin of this. So basically, you'll have career stresses. You'll have a toxic environment. And where is the toxic environment coming from? This is basically because of the biases that are there. Okay, you've got biases, you've got clouds, you've got groups of people and things like that, and that causes the environment. The other thing that happens is bigotry. Bigotry is, obviously, you see these owls, they are looking at one person as if something is wrong with this person. That is bigotry. The other thing is obviously rampant discrimination. This is the basic thing that happens in any workplace. It can happen in any workplace, and which can cause severe issues in terms of mental health crisis. Okay, for various employees. I mean, they would say, why am I being singled out? Why am I not being considered for certain things? Why am I have to really work into a different career route? Why is my career route more winded than the other person, despite being of the same level? Okay, one simple example is the BBC. BBC did a survey amongst genders. Okay, so if you are in a level A, and if you have males and females, it was found that males would go very quickly, would rise the ladder very quickly, and they would get much higher salaries, even if they're at the same level as that of the female. That is wrong, right? That is completely wrong. They're not doing anything special. So the males are not doing anything more special than the females. No, they're doing the same thing. But still, for some strange reason, they were paid a bit more. That is where your bias comes in. That's where your institutional bias comes in. And that was changed after, I think, about 7 years ago. Okay, so what do you do? What do you do is, of course, you will have to have prevention strategies. I'm going to come to students very quickly now. Okay. Prevention strategies. What do you have to do? First thing is awareness. Make sure that you're aware of the biases that occur in your workplace. Everyone should be aware of them. If the moment everyone is aware of them, the moment they know that something with their preconceived imaginations that is incorrect, they will try to change. Of course, we are all human. We can have our preconceived biases. But if we are made aware that, okay, that particular thing is not particularly welcome, then it is a good chance that people are much more sensitive. Okay? Compassion and inclusivity building, mental health awareness. It's important to recognize the signs of mental health crisis. It's extremely important. Okay. The other thing is feedback and mentoring schemes. Okay. One of the things that can help is having a 360-degree feedback. So basically, your boss would give you a feedback. Your juniors would actually come back to you to give you a feedback. Okay. So if there is a 360-degree feedback, possibly that will also help in terms of making sure that you've got an open atmosphere around you. Okay. This particularly empowers everyone. So in fact, in our university, we do have a 360-degree feedback wherein students give us the feedback and we give the feedback to them. So there is always this thing. Okay. Of course, you will have all kinds of other issues, but at least one thing that is true is that the trust between the students and the academics is a bit more stronger. Okay. So essentially, that's what it does. It says this empowers your juniors to share honest opinions and ideas. One important thing that happens is acting on feedback. Okay. So if someone says that, okay, this particular system doesn't work, you go to the certain boss and you say that, look, this is my problem. I think some of the systems that you have devised, it doesn't work. And if the boss doesn't act, it really doesn't help. Okay. So acting on feedback and demonstrating this will help the trust and definitely help the awareness and help the atmosphere of the place. So an important thing is you need to have an inclusive support. Okay. You need to have a disability support, a mental health support. This is a very ideal system, but it's important to make sure that we yearn towards that system. Okay. Basically, we shouldn't fix current symptoms. We just don't fix symptoms. We need to fix the root problem. Okay. This is where I'm just now going to jump to what exactly happens with students. Okay. So this is again various ways in which you can deal with mental health awareness and resilience and respect and dignity is basically making sure training, 360-degree feedback, mentoring. And mentoring happens within universities. It has to happen elsewhere as well. It has to happen in corporate as well. And then, of course, services, where you have mental health services, disability services, inclusive support, and awareness. Okay. Now, specifically coming to student stresses, I mean, I think one of the things I would want is basically a very, very interactive session, as I mentioned in the video. Okay. So can one of you, I don't know, I'm not able to see the screen at all, but let me just see. So what you can probably do is let me know what are the typical stresses that students experience. You can probably type it in chat, or if you want, you can. Is there a chat facility?
Yes, sir. Yes, sir. There is.
Yeah. Is there anyone putting anything in chat? So you can tell what type of student stresses, what are the different types of student stresses that people can see or people experience? I have
here we have, I think, Guneet Gola has said that family pressure.
Family pressure, very good. Very good, very good. So basically, you would have family pressure, you would have career stress. So one of the things I have done here, I've just put in something. The first thing is within family, if there is medical health problems, okay, I mean, we deal with students who have cancer within their family, rampant in the family. Okay, so they're always worried about their family's mental health, their family's health, and so on and so forth. There are other pressures. So there is family pressures. And in fact, one of you, Gunik Golar, mentioned about family pressure. Okay, some things about, oh, you have to behave in that way. So look at how these people have performed and look at what you have. Okay. The other thing is financial pressure, right? Financial pressure. Oh, am I being a burden on my family? Okay. Am I being a burden on my family? I mean, I need to buy all these things, and is this causing stress on my family? The other thing is obviously academic pressure. You've got deadlines, assignments, exams, and all kinds of things. That is the usual academic pressure. The other thing that happens, which is actually very subtle, is discrimination among students themselves. Okay, discrimination among students themselves is a really good important cause for mental health issues. I can tell you. So we do have a program called as widening participation. So we look at students from extremely poor backgrounds. We actually to enable them for university education. Okay, and some of them they feel that they don't fit with the other people, with those who have come from the usual college and this and that, and then finally they come to the university. So they feel that they are not being integrated well enough. So we try to eliminate that. So they feel discriminated as well. So, and that is an important driver as a kind of a trigger for the mental health issues. And of course, wherever there is politics, okay, wherever there is politics, I mean, if there's healthy politics, that's a different thing. But if you have political issues all over the place, then that causes severe issues among students. Okay, and I don't need to give examples on that. They're very, very divisive. Politics by itself can be very divisive. So that causes discrimination at a different level. The other thing which happens is access. Access. It's not access to. It's access to resources. So access to resources is a problem. Some people can have easy access to the to study material. Some people will not. Some people are not able to afford internet connections. Some people are not. Many people will not be having power or electric power to actually enable access. Okay, so that causes a different type of stress. They're always stressed. Damn, I need to submit this assignment. I'm not sure whether I'll have internet connections or not. Okay, I'm not sure whether I'm going to have even power to make sure that I'm able to plug on to my computer, or even write on notes because I will not have lights in my house. Okay, and of course, the issue of career. So that is usually academic and career issues are common amongst students, but the main causes for mental health are basically the others that come together along with all of them. Okay, so typically this is a mosaic of worries that students have. Students can suffer from complex issues, and extremely complex issues, an extremely complex environment. 2 days ago, I was dealing with a student who was a PhD student who had been trying to care for his mother for a very, very long period of time during COVID. And because he was caring for his mother for such a period of time, he was getting increasingly stressed about how many steps back he has taken, because he was not able to just concentrate on his work. And that led to one thing to another. He started taking medications. He became an addict for certain medication, and so on and so forth. So that just spiraled out of control. Okay, so there are usually combinations of things that actually trigger a mental health issue. Thank you, Swati. Yeah, if you have any questions, do put it in the chat, and I'm constantly looking at the chat as well, so I can probably answer that quickly. So what do you do?
Yeah, so continue.
So what do you do for success? What do you do? The thing is, success is such a strange word. I mean, success is such a relative word. Each one has their own definition of success. So for some, getting through a very difficult time itself is a major success. Yes, that would my goal. That would be my goal. The first thing is talk. Talk to us. Talk to anyone you know. Talk to your doctors. Don't feel ashamed. If you really feel that, I mean, one of the things when I was trained for mental health awareness, one of the things we have been trained is, if I spot anyone in a situation, I ask them, are you trying to, do you have thoughts of taking your own life? I do ask that question directly. Okay, and that helps, because that probably stops them from thinking that. Okay, so and we know statistically, we know that asking that question itself stops many suicides. Okay, because suicides happen in a very silent environment, because there's no one to talk to. Okay, so definitely talk to your doctors or counselors. If you don't have access to a doctor, I can imagine that there could not be easy access to the doctor. Talk to your family. If you cannot talk to your family for whatever reason, complex families are there, so don't talk to your friends. Talk to your seniors. Talk to academic staff. Talk to support services. Talk to alumni. Okay, the most important thing is talk. Okay, if you don't tell the issues that you have, it's very difficult to find a solution. Okay, it's very, very difficult to find a solution. The other important thing that you can do is, we have shown this through immense number of scientific studies, make sure that you're active. Okay, I know that how difficult it is to say this, but if you are stuck in a room, in a kind of a mental health spiral, in depression, that is the worst thing that you can be in. Okay, we completely know that. One of the recommendations by all doctors is that make sure that you're active, you're into sport and exercise. That helps your mental health, that helps your brain develop much better. Okay, so ensure you do get sport and exercise, and you will prevent going into a spiral. Prevent yourself going into a spiral. There are other things like wellness workshops and things like that. People do yoga, people do all kinds of things. So and yeah, so things like sport and exercise, they're the best, actually. One of the things that can immediately help with mental health issues. But mental health is a very complex scenario. In some cases, we have seen patients where depression is so strong that they're just not able to move. Okay, those are extremely critical situations. They are clinically depressed, and that's an emergency situation. Okay, they have to be taken to a hospital immediately. Okay, so sport and exercise does help. So basically, as Gandhi's words put it, like, health is wealth. Okay, so it's important that you are healthy, and sport and exercise do help with that. And the other thing is support for studies. Do ask for support for studies. If you are actually struggling with an assignment, do ask for help. You can ask for help with your supervisors or with your lecturers. You can ask for help along with your colleagues, among your colleagues. Okay. Of course, it's not. I mean, of course, exams would be a different issue. But in other cases, especially support for your studies, preparation for your exams, do ask for help. One of the important things that the pandemic has taught us is to be our own time managers. Okay, so basically, that's a good question. I think I've got a question here which says how to manage time and get interested in studies. So there are various techniques in which you can manage time. The first thing is you have to list down. The first thing what I would do is, if I'm really getting confused on so many things to do, I'll just list down on a pen and paper what I have to do next. Okay, I'll just list down everything that I need to do. As I list down, it actually becomes more clearer what is the pattern in which I can attack it. Okay, so do very, very simple techniques like writing down things, what you have to do, and making sure that you can plan them well and stick to the plans. Do have breaks. Okay, do have breaks. Do have breaks. How to get interested in studies? Studies are not just book learning. Studies can be done through different methods. If you have access to YouTube videos, look at those videos and learn from them. Okay, so if you are, for example, if you want to know about signal processing, there are tons of very, very informative animations on YouTube, which means that you don't need to open a book, but you actually can just listen to them. And what you can do, what you suggest is, yeah. So basically, the other question what Swapnil has asked is about preparing for competitive exams, but exams are not going to happen. Yeah, I mean, some of the things, one thing I think there has to be a recognition of is that many things are out of our control. Okay, like setting the times for competitive exams, setting the limits of competitive exams and things like that. So many things are out of the control. So there is little what we as students can do. Okay, the important thing that you can do is just keep preparing yourself. Make sure that, I mean, a good thing that can happen when a competitive exams don't happen is you get more time to study. You get more time to study. Okay, so basically, if you look at from that angle, if competitive exams are not happening but you're preparing for them, that's fine. You've got more time for you to, but this is something which is out of anyone's control. Okay, we can do internal exams will happen again, but make sure that you invest that time in preparing for these further. I think with this, I've stopped. I've stopped my talk, and do ask me questions. How to be productive? Oh, good. Good question. Again, productivity is completely related to time. Okay, is completely related to time. So basically, if you have a lot of things to do, write them down and make sure that you are doing it. So the moment you find, I mean, the thing is, it's almost like when you finish a kind of an agenda, it's almost like a kind of a kick. Like, oh, I finished this, now the next thing. If I just finish all of these things, I'm done with it. So basically, if you have these time, if you manage your time well, you can be productive. Failure. Oh, failure. Failure is the pillar to success. Okay? Failure doesn't mean that things are bad. In fact, I learn a lot from failures than from being successful. Okay? I learn a lot from failing things. When things don't work, in fact, I get more learning out of it. So basically, a failure is the pillars to success. So basically, any failure you have, find out the cause for the failure. Find out why did it not work this time, and work on it. Okay, how to manage time, how to get out of inferiority complex is basically because of is a consequence of some sort of a bias that has happened before. Okay, so I'm sorry to hear this, but inferiority complex is it can be a clinical condition. You may need some counseling if it is very severe. You may need some counseling. You may need to go to a doctor. But at the same time, inferiority, most of these complexes are fictitious, are fiction. So they're not true at all. Okay. So one thing possibly that you can probably gain confidence in is actually knowing that most of those complexes are false. Okay. Which means that you are slowly getting out of your inferiority complex, but do have counseling. Okay. If that is really, really affecting you. It's a consequence of a bias which has happened before. Any further questions?
Guys, if you're having any questions, you can post them in chat box.
Or you can ask it on, or you can ask simply. We can. I prefer to see your faces actually.
Sagar has raised the hand. Sagar.
Prashant, if you're done with your presentation, can you stop sharing?
Yeah, I'm just.
Sagar Kamble. Sagar Kamble, you raised the hand. Please.
Is justice delayed? Is justice emotional intelligence? Yeah. So a good point actually. So justice. I mean, it's a complex thing here. Yes, definitely, I completely agree. If there is any sort of a delay in justice, that is denial of justice. And if you find that, this is the question from Mayuri, if you find that there has been something gone wrong, you need to really report that immediately. Okay, report it to a doctor, report it to your supervisors or academic staff or whosoever it is. And of course, once you go to those authorities, things are not under your control anymore. Okay. And you're absolutely right. Not in every situation you can get justice very soon as possible. How to ignore concentration on stuff. Sagar, this is I think you've asked a very good question. You will, I mean, we are all humans, okay? And when we study, because we are all humans, we'll all have many thoughts when we are doing anything, okay? The important thing is to ensure, you don't need to ignore them, but you need to manage them, if you know what I mean, okay? You need to manage those thoughts and make sure that you're able to just focus on what you are to do, okay? So, so one of the things that you can possibly do is, again, it's a part of the time management thing. So you list down everything and then keep doing in a sequential manner. Okay, hopefully that helps with your concentration. But it is just human that you will get so many thoughts while you're working on something. Okay, and you may not need to ignore them, but you need to manage them. If that answers your question, Sagar. Yeah, there is this suggestion to do a SWOT analysis. Yeah, a SWOT analysis can be done to overcome the inferiority complex. Right. Any further questions, please? Emotional intelligence, that's a good thing by Swapnil. It's a very, very large area of emotional intelligence to understand what are the emotional states of others and things like that. So, and basically it comes under behavior as well. So making sure that we don't make a flippant comment. For example, this has happened in India. This happens everywhere, but it has happened in India that whenever we see anyone from Northeast, we use a certain word. It's best not to use it. They feel completely outlined there. Yeah. Yeah. It's just bad. How to avoid constant anxiety? Oh, anxiety is a clinical problem, Akanksha. You need to. I mean, it depends upon the level of anxiety. You need to really visit a doctor and mention about this. There are medications available, but again, at the same time, it's again management. I mean, anxiety is probably due to some sort of a stress that is building up. Okay. Some sort of a stress that is building up, or some sort of a stress that you have experienced before, so you don't want to face the same situation again, and so you're constantly being anxious. Okay, so that's where you would need some clinical intervention, but at the same time it requires some sort of a management as well. That one thing is, hopefully imagining, hopefully tell that this is not going to happen to you again, and therefore it is very unlikely that, or it is unlikely that the same situation might happen to you again. So it's best not to be anxious. But again, there could be kind of a medical element to it as well. Akansha, I'll tell you, anxiety can also come from physical health. Physical health. I mean, if you have a chronic problem, if anyone has a chronic problem, they will know that once they get that problem again, they're really anxious because they don't want to be in that situation again. So there could be an underlying physical problem as well, or a medical problem as well. Anger management. Anger management, again, is an important question. One thing is, it's a part of anxiety as well. Anger is a manifestation of anxiety. It can be a manifestation of depression as well. But again, anger management, the most important thing is to basically, an important thing which I have learned myself is make sure that you do take a break. Breaks are important for managing anger management. Take a break, do exercise, do sport, do whatever, and don't really allow yourself to think about things which constantly cause you angst. Okay, so I think that's one way to help with anger management. How to stay away from negative thoughts? Again, it's the same thing. Make sure that you're active. Make sure you've got a lot of things to do. Not things to do in terms of not just study, but at the same time do some games, play outside, play with people. I think one of the worst things that has happened is nowadays we don't play with. There's less amount of play to be done with colleagues and other people. When we were children, we used to play with kids. We used to play with everyone. And that physical activity is extremely important because that helps you to have respect to others, because games foster respect. Games also foster management skills. For example, if you're playing football, you have to really manage your time, and you need to really manage your way on making sure that your team can win. Okay. Can you suggest some? I think there are several books that can help you. That can help you. One is, I don't know if you look at the book by APJ Abdul Kalam, that is a good thing. That's a good book. Okay. What is how to manage stage daring? Oh, stage fear. Stage fear is the best way to manage stage fear is just speak to yourself in a mirror. Okay. At least for me it worked, but I don't know if it works for everyone else. I should say, speak to yourself in a mirror and speak loudly. Okay. Speak loudly. Speak loudly. So basically, that's. I've lost the. Okay, yeah. So stage fear. Yeah, speak to yourself in a mirror and do practice more stage. Well, please just practice speaking on a stage yourself. I think as and when you practice more, you actually get rid of the fear. It's the same as any sort of a phobia. For people who are worried, if you know rock climbers, obviously I know a friend who's really scared of rock climbing, but then the way he defeated rock climbing is by becoming a rock climber himself. So basically slow and steady wins the race in this case, especially with fear. How to become more patient? Because I think it's just a realization, Swati, that things don't just happen quickly. They cannot. They have their own time. They take their own time. And things, external stuff, you cannot have any control on it. So why really bother much about it? Okay. So I think you need to give, as students, we also need to make sure that we keep giving break to each other. Okay. We don't need to really put more anxiety. We don't really need to put real unmanageable goals. Okay, if you're setting goals to yourself, that's good, but do talk to others, saying that whether this will be have a goal, but don't have unrealistic expectations. Okay, have a goal, don't have unrealistic expectation. Yeah, I want to become an astronaut. Yeah, but that is a step-by-step process. Okay, you need to do this, you need to do that. It may take years. Don't say that I want to become an astronaut within 3 years. It won't be possible. No. Okay, so have a goal, but don't have weird expectations. How to become self-confident? Self-confidence, that's a good question. So it's again very similar to, I mean, did you see the, I mean, I'll bring the example of January 6th, the White House attack. Oh, not the White House, sorry, the US Congress attack. Okay. If you look at the people who really stormed the White House during that day, okay, they were, I mean, one of them was wearing horns. That was wearing a very weird kind of a headdress. That guy, he walked into the US Congress with such a confident looking person, okay, and obviously he was a criminal. Okay, he was a criminal. He knew that he had nothing with them. Okay? He was a criminal. He was doing all kinds of weird stuff. But they had this kind of they had this extreme self-confidence in that, yeah, nothing is going to happen to me. I can sit on Nancy Pelosi's desk, or I can sit on the head of the Congress table, and no one is going to tell me that. Obviously, we don't want to have that. Okay, self-confidence is something which everyone possesses. You already are self-confident, Janvi. It's the matter of fact that how you bring it up when you face others. Okay, how you make yourself, you first of all get, even I had this issue where I would become extremely conscious about what will others think about me. People will not think anything about you. People will in fact praise you for what you're doing. Okay, so if you're able to speak outside, if you're able to speak to people and convey your views in a way that is normal, but at the same time pretty strong, that's good. You will become self-confident. Okay, so everyone has the self-confidence. It's the matter of bringing them out. If we cannot concentrate on one thing for a long time, what should we do? Join the club. I cannot concentrate on one thing at the long time for a long time. So I keep changing. I keep doing multiple things at the same time. And there's nothing wrong with it, as long as you know where you have left and you come back to it to finish it. Okay. But of course, you should not be, I mean, I'm not talking about distractions here. Okay. So if you have multiple things to do, you can start one thing. If you're getting stuck there, you move on to the other and then come back to the rest again. Okay. There's nothing to stop you from, there's nothing wrong if you cannot concentrate on one thing for a long time, but you need to come back to it again. How to avoid feeling overwhelmed from workload? So that's a complex question, actually. I think one of the things that is important is, again, expectations. Yeah. In an engineering studies are going to be difficult. Okay. An engineer during their studies, they have to have so much of work done. And that's why you get an accredited degree. Okay, so it's important to realize that you will be having a lot of workload. Okay, it's important to realize that. Again, the reasons why many students get overwhelmed is because somehow they set extremely ambitious expectations out of themselves. Okay, I can give you an example. So we do have design projects, which people have submitted last week. One student wanted, for some reason, he could not, he told me later that he submitted it pretty late because he wanted to make it perfect. And I asked him, what is perfect here? How can you have, what is a perfect report? Can you tell me what is a perfect report? So essentially he kept putting expectations, like saying that, oh, I need to be, this has to be done, this has to be, all my pressure calculations should be to the 10th digit or whatever it is. It has to be done exactly, precisely, and that's why he put a lot of effort in those aspects. No, don't have those expectations. Okay, so one way is, if you manage your expectations, you will probably avoid feeling overwhelmed. And in any engineering curriculum, you will have a lot of workload. That is unavoidable. But don't have unexpected, don't put yourself extremely difficult expectations. And if you're putting any expectations, talk to other people. Talk to other people, saying that, talk to your friends, talk to your classmates, saying that, am I really crazy here? Am I doing this correctly? Am I doing this? Just keep questioning that. Okay, so hopefully they can also give their input to help you out. How to overcome self-doubt. Self-doubt is the same as having less confidence. Okay, so we have already discussed about that. Tell us some confusion about in taking decisions. Any decision may have, taking a decision or answering a question will have several answers. One thing is, Malhari, is making sure that you understand what are the positives and what are the negatives of taking a certain decision. So play those scenarios. If I take this decision, this is what can happen. This is what cannot happen. Okay. So from that, you will yourself say, okay, you will also try to set your own expectations. It may not be correct, but at the same time. So it's, as Deepak mentioned, make sure that you have various outcomes. List down all your outcomes that can help with the decision. Okay. Then once you, hopefully that will help with your decision-making process. How to get rid of useless emotional crisis. This is any sort of a Mugdha. This is not an unusual situation. It happens to everyone. Okay, emotional crisis can happen at any stage in anyone's life, not just to teens. It can happen to anyone at any time. Okay, usually driven by external factors. Okay, usually driven by external factors. It could be within the family. It could be breakups. It could be divorce. It could be anything. Absolutely anything. Okay, it could be deaths, it could be bereavement, all kinds of things, illnesses and things like that. Okay, you can't, I mean, life events, you can't help them. You can't really do much about them. Okay, but the important thing is we need to know how to manage these, and each one has their own method to manage them. Okay, each one has their own method to manage them. One of the important things, as I mentioned in my presentation, is talk to people around you. Okay, if you cannot talk to your family for whatever reason, talk to your friends, talk to someone, talk to some alumni or something. Okay, they may give you some helpful advice or helpful suggestions that can be done to manage it. Okay, can you please suggest the best thing to do in leisure? Oh, do your hobbies. Just do what you like to do. Do what, I mean, the thing is, usually in my leisure, I'm with my family. And earlier, before I got married, I was probably cycling or running outside or whatever it is. So relax, just don't worry. Do what you want, do your hobby. Because one thing which we have forgotten is basically pursuing our hobbies. So make sure that you do your hobbies, because if you do your hobbies, that will probably make you more happier. Any further questions?
Guys, if you're having questions, you can put them in chat box, or you can ask him directly. So I think, sir, this was all. I can't see any more questions here.
Sir, Rajiv, you would like to add something? Yes.
No, I think Prashant covered in very great detail, and I think Prashant also alluded to one thing that I think stood out for me, which I think has really helped me, which you don't realize as much, as growing up, especially in India, is the importance of assessing yourself and setting your boundaries, knowing what you are capable of, right?
Yeah.
I think a lot of the inferiority complexes or superiority complexes, for that matter, or what I call, the victimized mentality that I think
Yes.
all of us, fall into easily, where you think that the world is against you. When you are doing everything in your power, but nothing seems to be happening. I think a lot of it is also because I don't think we have assessed ourselves very well, and I think Prashant articulated that in a very engineering term around setting boundaries and how you set experiments, etc. But I think that's very, very important. Not everybody can be Prashant Valluri, or not everybody can be Santosh Ingole, because you are not, right? And so trying to be something that you're not is stupid by design, because you've started out the wrong way. So I think trying to make sure that you get into that kind of mindset, I think, really helps you, because then I think you will make the right choices.
Yeah.
That's kind of very important. And I think the second most important thing, which Prashant alluded to, in my mind, that's helped me also, is kind of learning from your failures. All of you all are engineers, and engineers, and all progress that humankind has seen is because of experiments by design means you will fail. Right, that is the operational definition of an experiment. Most experiments fail. Not, there are only very few experiments that work, and the few that work, obviously, allows you to make great progress. And I think the same is true for life. You will try out many things. Not everything will work. It's okay. But I think it's important to differentiate between a failure that allows you to learn and mistakes that are stupid. So if you keep repeating the same mistake over and over again, then I think it's on you. It's stupidity.
Yeah.
But if you try something else and you have given it your best shot, then I think it's an experiment that failed. You learn from it and you move on and do better next time. And I think those two would be the most important things for me. I guess if there were things to take away from what Prashant covered, be it honest to yourself, assess your capabilities, and be responsible in your failures.
Yeah. Thanks, Rajiv. That's pretty good. I mean, last week, so we're having these design projects done with our students, and this is along with companies. And one student was saying, "I want to make the perfect design." What is the perfect design? What the hell is that? Please tell me. Please tell me. We would have made so many great bridges, and everything would be so perfect.
Yeah.
Great. Really, it's.
We have some, just 2 minutes. I just want something. So, I think most important thing is stop overthinking.
Yeah.
Right? I'll explain you why I say that. Because we realize after we reach 40, right? we realize that we used to think we want to grow in the organization, we want to make a career, but really, if you want to learn something from the alumni who are already at a certain level, they will tell you that this is like a race. Okay, somebody wins, somebody loses. So don't overthink about your career. Just enjoy the moment that you are right now living. Because as a student, how much we enjoy, we are really missing it. Thank you.
That's a very good point, Deepak and Rajiv. Actually, very, very good point. Santosh, one of the things, I mean, I was getting this idea yesterday. Obviously, the Duke of Edinburgh died, so he's Queen's husband. But one of the good things he did, extremely good things he did, was he instituted something called as the Duke of Edinburgh Award for the youth in the UK. And basically what that does is they take students and they take children from all backgrounds and they put them into life tasks, completely life tasks, not studies. They have to build up things from, I mean, it's like an Engineers Without Borders program, if you know what that is. So Engineers Without Borders program is basically we take our engineering students, we may go to Bhutan or Nepal or Kenya or some remote part of the United States and help them with something which we had no idea about. Like, for example, taking water from an underground resource through engineering solution. Okay? So the thing is, and it is those kinds of issues which the Duke of Edinburgh did not with engineering students, but with actually class 8, between class 8 to say class 12 students. Okay. So giving them those life learnings, like they obviously will fail, they will actually, obviously there would be blood, sweat, tears all over the place. I'm not able to do this, I'm not able to do that. But it's important to have that. It's important to know that you can fail, and it's an important learning to know that you can fail. Okay, we are not, I mean, human species is not designed for being successful. We are terrible, actually. Okay, the only reason we have been successful after so many years of evolution is because we have made systems that can help us be successful. But ultimately, we know that some systems don't work. And yeah, and that's why you have COVID virus, which defeated us in every aspect.
Very true, Prashant. Actually, Nitin Akhade, he's here also. He is taking that type of project. Actually, he is actually working also as a part of his consultancy firm, and he is trying to get the students also for the live projects like this, going to the Naxalite affected places and
Absolutely.
taking the projects and to the tribal people. Like that, when I met him personally, he explained me all those projects, and all those projects are really, really excellent.
So I think as Alumni Association, possibly we can do something which is similar to the Duke of Edinburgh Award, and let's see. Obviously, this will take some time to prepare, but anyway, we'll see what we can do.
Yes, yes. Yes,
So
next.
I think with this, we should wrap up. I would really like to thank Mr. Prashant Valluri for spending his valuable time with us. And I would like to call Jagruti Khatal for the vote of thanks. Jagruti.
So, hello guys, I'm Jagruti. I'm here to present the vote of thanks for the today's webinar. I would like to thank our webinar speaker, Professor Dr. Prashant Valluri, for enlightening us with their knowledge. Today's webinar was full of knowledge and interesting things. It gave us deep insights into the topic and also revealed many interesting facts. I'm pretty sure that the precious knowledge that Dr. Prashant Valluri gave us will definitely help us in our studies as well as in our future. Once again, I would like to thank him for taking out the precious time out of his busy schedule. I would also like to thank the BAA team who really worked hard to make this event successful. Also thanks to all the students present over here for paying attention and learning. Thank you all.
Thank you,
Thank you.
Jagruti, for with this.
Thank you, everyone.
This
Thanks.
webinar is over.
Hey, thanks, Prashant. Thanks. Yeah, thanks everyone for attending.
Thank you.
Always good.
Thank you.
Thank you, Raju.
Bye bye.
Bye.